Okay.
Hi, my name is Madeline Davis, and today I'll be presenting the comparisons and contrasts of the healthcare systems and policies within Hungary and the United States. Hungary is a country over in Europe that is a little bit smaller than the United States and is not as developed. While it is not as developed as the United States, it is still considered to be a developing country. There are lots of similarities and differences within multiple different healthcare systems and policies with Hungary and the United States. To begin, Hungary has a different healthcare system than the United States because they have a single-payer government system and they provide universal health care coverage to their population. Hungary has the National Health Insurance Fund, which provides health insurance to the entire country, and there aren't differences between city to city. Universal healthcare coverage is defined as coverage of essential health services or average coverage of essential services based on tracer interventions. That includes reproductive, maternal, newborn and child health, infectious diseases, non-communicable diseases, and service capacity and access among the general and most disadvantaged populations. In Hungary, they have a 70 universal healthcare index, while the threshold average index is 80. The United States actually has greater than or equal to an 80 index. Infant mortality is when an infant dies before their first year of life, whether that be from low birth weight, lack of prenatal care, health disparities, etc. Infant mortality is lower in Hungary than it is in the United States, but not by much. Because of the fact that both Hungary and the United States are considered developed countries, their rates of infant mortality should actually be much lower than they are. Like, for example, Japan, which is a very developed country as well, their infant mortality rate is 2.1 per 1,000 births, whereas in Hungary, that rate is 4.4 per 1,000 births. A study found that in 1990, the infant mortality in Hungary was actually 15.3 per 1,000 births, but has steadily decreased over the years to now an all-time low of 4.4. In the United States, this number is just a little bit higher than Hungary, whereas it is 5.4 per 1,000 births. The same study found that in 1990 the rate was 9.4 per 1,000 and has also steadily decreased, but has not changed as dramatically as Hungary. For healthcare spending, a study was found by the OECD and found that the average health spending to be about 8.9% of GDP in 2013. Hungary was found to be a little bit below average at a 7.4% spending of GDP. This is interesting because Hungary has the universal healthcare system, so they should be spending a little bit more on their healthcare, which could be showing why they don't have as great of healthcare odds as other countries. In Hungary, they do have a lower GDP spending, but their out-of-pocket spending is much higher than a lot of other countries. In Europe, the average was 19% of spending, but Hungary's average was 28%, which is actually a lot for out-of-pocket spending. Amazing enough, the United States was found to have a health spending far above average at 16.4% GDP. Out of all the countries that OECD averaged, the United States actually had the highest of GDP spending, while Hungary had the 8th lowest. Tobacco usage is such a prevalent statistic in this day and age because tobacco usage is still one of the leading causes of preventable deaths in almost all of the countries. In Hungary, it is found that 32% of men and 24.8% of women smoke cigarettes. Another study actually found that 1 in 4 people in Hungary smoke cigarettes. Since Hungary has some very high rates of smoking, that also leads to very high rates of deaths from smoking, which could be prevented. Act LV3 prohibits companies from widely advertising cigarettes, and Act XL2 prohibits the act of smoking in common public places. Because of the high rates of smoking and the high rates of deaths that could have been prevented, recently Hungary has been implementing these policies to decrease the rates of smoking, which they have gone down a little bit, but not as much as we'd like to see. The United States have similar policies as well. including lack of advertisements for tobacco companies, and also you can no longer smoke in public places, which the United States has this policy because at a lot of colleges, because Ohio State, you can't smoke cigarettes on any part of the campus, including the medical center. The United States have found to have 50% of women and 19.5% of men smoking. This is interesting because there's a huge difference between the male statistics, while Hungary has 32% and United States have 19.5%, but there's not as diverse differences between females. Preventable deaths are deaths which could have been avoided by public health interventions focusing on wider determinants of public health such as behavior and lifestyle factors, socioeconomic status, and environmental factors. The rate of preventable deaths in Hungary in 2013 were 417 per 100,000 deaths, and in 2014 it dropped just a little bit to 414.3 per 100,000 deaths. Heart disease was the leading cause of death in Hungary, with lung cancer coming up as a close second. This is interesting because heart disease is also the leading cause of death in the United States and also many other countries. The United States has surprisingly lower rates of cancer than other countries, but it still is high compared to what it should be. Getting safe water is important because there are so many places in the world that don't have access to safe water, which leads to more diseases and higher rates of death. In 2015, 71% of the global population used a safely managed drinking water service, which is an improved drinking water source located on premises, available when needed, and free from contamination. The United States and Hungary, both being such developed countries, did not have much of a difference between their access of safe drinking water. The United States had 100% access, while Hungary was found to have 99%. So it is barely a difference at all. And between both rural and urban areas of both places, they both had between 96% and 99% of access to safe and clean drinking water, which is awesome. Access to mental health care services is incredibly important because suicide is still one of the leading causes of death in the United States and other countries. Comparing both the United States and Hungary, they both had similar low number of percentages of unmet mental health care services. Because their numbers are so low, this is actually very good because that means that both countries are thriving at meeting healthcare services and providing care to these people with mental health problems. Hungary was found to have an average of 1.4% of people having unmet mental health care, which is far below the Europe average of 3%. The United States had a slightly above average than Hungary at 1.6%, but nothing too dramatic. Surprisingly, the United States had a higher unmet mental health percentage with women, which is 3%, than men, which is 1.8%, compared to Hungary with men having 0.7% and women 1.9%. So in both countries, the women were more likely to have unmet mental health care services than men. Also, it was found that in both countries, their highest rates of unmet mental health care was in the middle ages, that being ages 45 to 64. So teenage pregnancy is any time a girl gets pregnant from ages 15 to 19, whether they carry to term, miscarriage, or have an abortion. And it is found that around 21 million girls ages 15 to 19 get pregnant every single year. Birth-related deaths are also the leading cause of death for girls ages 15 to 19. In Hungary, the rate of teen pregnancies is 38 per 1,000 females, and in the United States, the rate is much higher at almost double of 57 per 1,000 females. It's actually interesting because Hungary has found to have greater rates of abortions than the United States. So in Hungary, 41% of girls had abortions, while in the United States, it was almost half of that, at only 26% of girls had abortions. So there are more teenage girls in the United States following to term, whether they're giving up for adoption or keeping the baby themselves, than in Hungary when they're more likely to have an abortion. Hungary and the United States are both considered to be developed countries, or at least both considered to be developing countries, so they have very similar health statistics but some are dramatically different, such as social and economic environment with teenage pregnancies or tobacco usages and public health prevention. Hungary has a better healthcare system, whereas they have the single-payer system where the government pays for everything and they have universal healthcare coverage than the United States. But the setup of Hungary is better, but they spend less GDP, which means they spend more out of pocket than they do in the United States. Thank you for watching my presentation on Hungary versus the United States, comparing and contrasting healthcare systems and policies.